Hello everyone, I am Dr. Samuel Ebenezer, Plastic and Reconstructive Surgeon at LK Hospital, Pallavaram. Many would like to know what is plastic surgery. Plastic surgery, the first thing that comes to the mind is cosmetic surgery. There are two parts in a plastic surgery. One is reconstructive surgery and the second part is cosmetic surgery or aesthetic surgery. First part is reconstructive surgery. That is any part, restoration of the deformed part to its form and function. There are many subspecialties in reconstructive surgeries. One is the general plastic surgery, like any injury can affect any part of the body, face, limbs, muscles, foot as well as hand. Injury can involve skin, muscle, bone, or near amputation of the limb or the fingers. All these things can be restored and reconstructed, and this field of plastic surgery is called reconstructive surgery. Suppose or trauma we lose a skin, we replace the skin. It's called a skin graft. Skin. Sometimes trauma might be so severe, bones exposed are fractured are. So we work as a team. The orthopedic team, they come and fix the fracture, either internally or externally putting an implant. Fix we cover that fractured part with a muscle or a local tissue, or we bring tissues from other sides to the fractured area, and the wound heals in a matter of 3 to 4 weeks. And the particular patient will be able to walk back again in another 6 to 8 weeks. And he is restored to his original form, near normal of his original form as early as possible. This is general plastic surgery. And there are surgeries like cancer surgery where some part of the tissue will be removed. When this part of tissue removed, we reconstruct it. Like when there is a jaw surgery involving cancer, they remove the bone, the tissues around it. We take a bone from some other part like a leg bone and a tissue along with that and reconstruct the part of the lower part of the face, so that in future the patient can have dentition as well as good mouth opening, and his oral function, mandibular function is completely near normally restored. And the other part of plastic surgery is called hand surgery. Hand surgery deals with A to Z of all the injuries of the hand, from simple cuts that we get in the kitchen injuries or simple knife injuries to complex trauma injuries, mangled hand, or an amputation of the fingers. In any amputated finger can be restored to near normal by a surgery called microsurgery. We reattach the blood vessels, the nerves, the tendons, and the finger bones, so that in a course of time, the patient who had a complete amputation, the finger function can be completely restored. Apart from the thing with burns where the hands, fingers are all contracted due to scars, the scars can be excised and they can be replaced by appropriate flaps or skin grafts, so that the function of the hand is restored. The other field of plastic surgery, reconstructive surgery, is burn surgery. In burn surgery, it deals with the acute burns initially, and later on proper management of the acute burns so that the deformities are much less. Also, it involves the sequelae of the scars, like a contracted neck like this or a contracted hand like this. All the scars are released in the appropriate time, and they are replaced with a skin graft or a flap, which can be a local flap or a microsurgical flap, and then appropriate physiotherapy. So burn surgery, after the deformity of the bones, we make the patient to be as a common man, and he is restored to his own form before the burns. The other part of surgery is a congenital plastic surgery. Many children are born with some congenital deformities. Sometimes they have two fingers, two fingers will be fused together, called syndactyly, or cleft lip, cleft palate, பிளவு உதடு, பிளவு palate சொல்லுவாங்க, or some craniofacial deformities, or some other deformities like spina bifida. All these things have appropriate reconstructive surgery. The child will be made normal so that the child's future is restored both psychologically as well as in the functional part. The other part of plastic surgery is diabetic foot surgery. We get number of diabetic ulcers, and they are dealt properly so that many amputations can be avoided and many calluses can be prevented, and many raw areas can be treated appropriately surgically, and also a proper footwear that restores the patient back to his form. In diabetic foot ulcer also we can perform surgeries so that they prevent further deformities. The other part of plastic surgery is called cosmetic surgery. Cosmetic surgery, it's also called aesthetic surgery. It involves surgery of a patient who doesn't have any abnormality but improves the form, like sagging face, a facelift is done, a brow lift is done, and for the tummy, which is a sagging tummy, a tummy tuck is done. We call it as abdominoplasty. And there are a number of plastic surgery procedures, cosmetic surgical procedures for the breast, like for a toast breast or a sagging breast, we do a breast lift. For a small breast, we can augment the size. Suppose the size of the breast is too big, we do a breast reduction surgery. Apart from them, we have something called liposuction. What is liposuction? Is suctioning the fat by appropriate machine so that fat alone is sucked. Some areas, however, we do exercises, the fat doesn't go. It's a resistant fat, like in the hip, lateral aspect of the thigh, inner thighs, underarms, everything. So these things, they are amenable for liposuction. Liposuction can be done in any part of the body under anesthesia as well as under IV sedation. Also, there is something called male plastic surgery for breasts, called gynecomastia. We do surgery through small pinholes so that the excess breast tissue as well as fat is suctioned and the near normal male breasts are done. So plastic surgery as a whole it has two main categories, reconstructive as well as aesthetic surgery, and we are here happy to help you out or all the deformities either in the reconstructive part or in the aesthetic part. Thank you.